Well, the Health and Wellbeing Board is a new requirement for all top-tier local authorities. It was introduced in the Health and Social Care Act, so since April every local authority has had to have one. And really it brings together the leaders across health, public health and social care in an area to work together to improve health and wellbeing for local people.
The Health and Wellbeing Board is there to bring together the health and social care bodies that commission services and encourage and influence them to commission together and give us better value for money in what is a changing landscape.
The Health and Wellbeing Board has members from 4 different organisations. So there's Medway Council, Medway Clinical Commissioning Group, NHS England and Healthwatch.
Whilst we would have had informal opportunities generally to meet and discuss strategies, this is a real formal structured approach to it, where we can all share best practice, we can share budgets to ensure that we do deliver a joined up health and social care service.
Well, the Health and Wellbeing Board has some very specific duties. The first of those is to conduct a joint strategic needs assessment. So this is looking at all the needs of the area that we would need to meet to improve health and wellbeing. And we do that in a very comprehensive way, and then that informs our joint health and wellbeing strategy, where we identify the key issues for the area that we need to address to improve health and wellbeing together across health, social care and public health. The Joint Health and Wellbeing Strategy identifies the key strategic themes for the area, and we have 5 strategic themes for Medway. These are working together to give every child a good start, enable our older population to live independently and well, prevent early death and increase years of healthy life, improve physical and mental health and wellbeing, and to reduce health inequalities. Give Every Child a Good Start in Life was chosen because we all know that the experiences that children have in early years are absolutely fundamental to achieving good health and wellbeing outcomes throughout their lives. So this is a key focus for the board. The second theme on enabling our older population to live independently and well was selected because we all know that we're seeing an increasing proportion of the population living into older age, and it's really important that we help them not only to live longer but to live more healthily as well. The third priority of preventing early death and adding years to life was selected because Medway has actually very poor health statistics in terms of life expectancy. Life expectancy for people in Medway is below the national average, and we have particularly high death rates from cancers and cardiovascular diseases. Our fourth priority around improving physical and mental health and wellbeing was selected because we know in Medway we have some significant risk factors for disease, such as increasing levels of obesity, high rates of smoking, lack of physical activity, and these are all factors that need addressing if we're to improve health and wellbeing. Our last strategic theme is reducing health inequalities. Health in Medway is worse than the average in the country, but we also have inequalities within Medway. So we have a gap in life expectancy across Medway of 9 years for men and 3 years for women. So this strategic theme is really a cross-cutting theme to reduce inequalities in health.
Our meetings are in public, and we encourage people to come along and attend those meetings. They're not public meetings where the public can speak at, so we can have some form of formality to them and planning and structure. But very much we want people to input through Healthwatch and directly through the board outside of that forum to help us contribute.
We all know that the council has many functions which impact on health and wellbeing. So I think every part of the council can think about how can they contribute to those strategic aims.
The future, I believe, is very positive. It means we need to make sure that people continue to talk and have difficult conversations and challenge each other to ensure that we are giving the public the best possible health and social care and in the right places. Medway does have quite considerable health inequalities, and if we're to ensure that there is a change in that then we need to ensure that we're influencing preventative measures or introducing preventative measures, and ensuring that people have a better understanding of how they can influence their own health and well-being.